Welcome to the new podcast by the International Dermoscopic Society on the spectrum of blue nevus-like lesions. This category includes a diverse group of melanocytic lesions characterized by the presence of blue color. It is due to the presence of melanin deep in the dermis, and the blue color is due to the Tyndall effect. The Tyndall effect is caused by melanin's preference for absorbing longer wavelengths of light and scattering shorter wavelengths, which manifest as the blue end of the spectrum. According to the WHO classification of blue lesions, we have several conditions from the benign to the malignant side. Dermal melanocytosis are benign congenital conditions. They include the ota nevus, which involves the face and the ocular area, like the conjunctiva or the sclera. The nevus of Ito involves the scapular or deltoid area, and the Mongolian spots, which are more common in Asian population, and they present as blue patch on the sacral area. These conditions are benign, but melanoma has been reported in nevus of Ito and Ota. Blue nevus is a common melanocytic proliferation. It could appear in every location, but it prefers the scalp, the face, the dorsum of the hands and the feet, the buttocks, or the mucous membranes. It is a lesion very stable over time. It appears as a flat or palpable, also a nodular lesion, but with a very blue homogeneous pattern without other criteria. Important, it has not vessels. It also could have other colors like the brown or white due to the fibrosis. VNT-activated deep penetrating nevus is a rare benign entity. It is well not described in literature. It could has a blue to brown pattern, frequently localized on the scalp, and on dermoscopy it also has been described a rainbow pattern. Pigmented epithelioid melanocytoma, also called PEM, is a proliferation with a low to intermediate malignant potential. It appears as a slow-growing nodule with blue and black color. It also could has an hypopigmented halo, and also it could has dotted or linear vessels. Animal type melanoma is no more included in the WHO classification, but is clinically considered as a malignant variant of the PEM, and it could be very aggressive. Melanoma arising in a blue nevus is a very rare condition. There are no data about dermoscopy in literature, but are reported only pathological studies. As we see in this image, melanoma rising in a blue nevus is a palpable lesion. At dermoscopy, we see a blue-black homogeneous area in the center of the lesion, but at the periphery, we see a pigmented brown network. This pattern could be misdiagnosed as a combined blue nevus. Combined blue nevi are benign condition, more common on the trunk. In these lesions, we see a well-circumscribed blue homogeneous area in the context of a dermal or compound nevus, where the pigmented network or the globules are very regular and symmetric. At the contrary, in the images from G to I, we see 3 examples of common melanoma. In this situation, we see asymmetry, and the blue is only a part of the lesion, but is not well circumscribed. In some cases, it is an important part of the lesion. Other criteria for melanoma are present, like the white streaks. The blue-black rule is a simple dermoscopic clue to recognize not only nodular common melanoma, but also the melanoma rising in a blue nevus. The blue-black feature is considered positive when the presence of these two colors involve at least 10% of the surface of the lesion, without criteria for seborrheic keratosis or angiokeratoma, such as, respectively, comedo-like openings or vascular lacunae. This feature has a 93.2% of negative predictive value. So, when we see blue and black in a nodular lesion, we have a high probability to have a melanoma. But also in melanoma rising in a blue nevus, is important to understand that there is the presence of blue with other criteria for melanoma, such as atypical network, atypical globus, or common asymmetry. Here, other examples of melanoma arising in blue nevi. As you see, there is a blue component, but without a clear-cut dermal or compound nevus around this area. For blue nevi looking like lesions, look for the benign pattern, and if it is absent, it might be a potential malignant lesion. Another entity that we need to know as dermatologists, even if it's not included in the WHO classification, is tumoral melanosis. It consists of a completely regressed melanoma, and it appears as a blue lesion with a granular pattern at the periphery. An important clue for blue lesions is the presence of vessels, because it is very rare to find linear or dotted or polymorphous vessels in a blue nevus. It's not impossible, but it's very rare. This study, published by Lallas et al. In 2022, analyzed several lesions predominated by the presence of blue color. So, not only blue nevus, but also angioma, basal cell carcinoma, and melanoma. These authors found that when we see the extension of blue color in a lesion for more than 75% of the surface, with a diffuse distribution and absence of prominent vessels, these features are predictors of benign lesion. In contrast, asymmetric distribution of blue color, the presence of blue clots, the coexistence of gray color, and the presence of linear vessels were significantly predictive of a malignant nature, posing an 8 to 10-fold increased probability to have a melanoma. So we worry about blue nevi looking like lesions because of an atypical morphology, but also because of the history. For instance, a patient who excised a nodular melanoma and in the future he develops flat or palpable blue lesions, not only near the scar, but also in distant areas. In this case, we need to suspect the possibility of melanoma metastasis, in transit, satellites, or distant metastasis. As we see in this article published very recently, the homogeneous blue pattern is one of the most common patterns for cutaneous melanoma metastasis. In conclusion, when we deal with a blue nevus looking like lesion that is flat, it has an homogeneous blue pattern, no other dermoscopic criteria, no vessels, we don't need to excise the lesion, except in case of a previous melanoma. At the contrary, when we deal with a nodular blue nevus looking like lesion, we need to excise the lesion when we have the blue area with the black color, or when we see other atypical criteria or other clue for melanoma, like atypical network, atypical globules and dots. The presence of vessels is very suggestive of a malignant nature. And of course, every situation in which age, location, and morphology don't match together, we need to excise the lesion to rule out a melanoma. Thank you and see you on the next podcast by the International Dermoscopic Society.